Are you suffering from painful periods, cramps, and nausea and find it hard to talk about? Let me help you understand what is called dysmenorrhea. Welcome to Women's Healthcare Answers, and this is Jeff McQueary, a Tennessee gynecologist. I want to focus on you, especially if your gynecologic problems are dominating your life and you want to take back control. You can solve your problems with answers and solutions I will give you. Well, dysmenorrhea is what we're talking about today, and that's a technical term for menstrual pain and period cramps. You can either have a primary form of that or a secondary form, and we'll talk about what that means. The primary type is associated with a simple cause of pain with periods. Most young women who experience painful periods typically start within a year of when they first began having them. Other common symptoms that kind of go along with painful periods are nausea, vomiting, diarrhea, headaches, muscle cramps, especially in your legs and anterior thighs, as well as poor sleeping. And this really may lead to poor attendance at school. But stay till the end to find out what really causes the most severe pain and how it can be treated. So if a physician has talked with you and taken a good history, a good medical history, gynecologic history, menstrual history, and family history, and it appears to them that it's just a simple problem, then a pelvic examination is not needed, and I know you're always glad to hear that. But if your doctor suspects that you may have a sexually transmitted disease, a pelvic examination should be done, just so you know. But how does pain with period cramps even happen? Well, your body produces what's called prostaglandins and leukotrienes. Both of these substances in your body cause inflammation, but prostaglandins also make the uterine muscles squeeze and contract, just like with a baby. And this decreases blood flow to the muscle tissue, causing pain. So this can be typically easily treated with medications such as ibuprofen or naproxen. And if that doesn't work, certainly hormones can also be tried as well. The type of hormones that can be used include oral contraceptives, the contraceptive patch, the vaginal ring, the progesterone single capsule implant in your arm, which in the US is called Nexplanon, Depo-Provera, which is the birth control shot, IUD, and even continuous norethindrone, which is a progesterone-only hormone. And this can be used and is very effective for severe pain. I use it all the time in my office, and patients do very well with it. But some non-hormonal treatments can be used to help with menstrual pain as well. And this would include things such as exercise, heating pad, there's herbal preparations, and even acupuncture has been used. But the thing is, just so you know, there's little evidence to show that any of that works much better than ibuprofen. Now, secondary menstrual pain is pain from something else. And it's suspected if your pain symptoms don't get better within 3 to 6 months of starting those treatments. If your pain is that persistent, then other causes of pain should be assessed by your doctor. At this point, there is felt to be something abnormal in the pelvis that is more than just the prostaglandins we were talking about earlier. Ultrasound should always be done at this point to see if there's anything abnormal within the pelvis, and should always be considered if initial treatments fail to help your problems. There are a lot of other causes of secondary pelvic pain, and they include, number 1, endometriosis. Also, this can be uterine abnormal formation. So the uterus may not have formed right before you were even born. But a stenosis or a porous opening in the cervical canal that doesn't let blood out can be a problem. But also an imperforate hymen, which is at the end of the vagina. And if this doesn't let blood flow out the vaginal opening, you can have pain and problems. Ovarian cysts can be a problem. This can be seen on ultrasound, as well as uterine polyps and fibroids. But you can also have a pelvic infection, such as pelvic inflammatory disease from gonorrhea or chlamydia or other problems if you're sexually active. And even scar tissue can cause pain. So if you like this video so far, hit the like button. It actually helps with YouTube. And please subscribe, because if you miss any of my new medical videos coming out every week, who am I going to talk to? Just give me a thumbs up and please comment. So back to the information you want. Endometriosis, being the most common cause of this type of pain in young women, should definitely be considered in you if you have persistent pain despite all the treatments that you've had. Endometriosis is tissue, like the lining of the uterus, that has implanted itself outside the uterus. Growth is stimulated by estrogen, and you know, young women, you have a lot of estrogen. But endometriosis in adolescence can be difficult to find and diagnose and is considered to be a chronic disease. And that's because it has the potential for getting much worse if it's left untreated and really scarring you. In fact, about 2/3 of young women with chronic pelvic pain will be diagnosed with endometriosis if they were to have surgery. So what's the typical surgery? Well, for endometriosis, it's called a diagnostic laparoscopy. And this is a minimally invasive surgery using small incisions, and we are looking through a lighted scope into your abdominal cavity. We look at the lining of the pelvis, under the ovaries, under the uterus. We look at the surface of the ovaries and the uterus as well as the fallopian tubes. And we can look all around the abdominal cavity, including even visualizing the appendix where endometriosis can also affect. I have found it about anywhere and everywhere in the belly, and even found endometriosis on the small bowel in a 12-year-old patient of mine once. But laparoscopy with either removal or cauterization of endometriosis is really the best therapy. Only uterine lining tissue found outside the uterus, both seen and biopsied at the time of surgery, can give you the true diagnosis of endometriosis. But although sometimes, especially if your gynecologist is very experienced, who just sees that tissue, they can give you that kind of diagnosis. But if there's still no resolution of pain for a period of time after surgery, then you might need medications that decrease your estrogen to aid in healing. These are medications like Lupron or Orilissa. These are what they're called in the US. Ibuprofen and naproxen should still be used, and narcotic pain medication should rarely be used for long-term control because of dependence problems. To sum it all up for endometriosis, the main objective in treatment is symptomatic relief of pain. But we also want to decrease the risk of the disease progressing to something more severe, such as scar tissue. And we want to protect your potential to be able to get pregnant later on. Just so you understand, typically, again, menstrual pain can be easily treated with ibuprofen and potentially even contraceptives. But it can be more severe, and that's why you need to go to your gynecologist to understand what might be happening. Don't be shy. You need to feel better, and typically your doctor can help you in a short period of time to feel the way you want to. So hopefully you feel you learned something. And as always, I've enjoyed being here with you. I would love to help you solve your problems at Women's Healthcare Answers. Remember, this video is meant for information purposes only. Please consult your own healthcare provider, but it's okay to reference the information I gave you.